Okay, so we are going to work through our first insulin practice scenario. The first one I have pulled up here is Charles Edwards. He's a 47-year-old patient who is here for a fractured right femur, and we are going to give him his 730 medications. So on his MAR, it has NPH insulin, 38 units sub-Q, AC, BID. So it's scheduled to be given at 7:30 and 4 p.m. Also has regular insulin 14 units sub-Q AM and regular insulin 4 units sub-Q PM. So you need to make sure that you read your comp card. It's going to tell you what time to give it. So when you're practicing, just pick a time and practice it. It could be any of the times. Your comp MARs are going to be the same patients, the same medications, just different dosages. So if you practice with these sufficiently, you should be ready to go. So because we don't have to go over to the MDU cart to get our insulins, we're going to do everything right here. So if I want to give NPH and regular insulin, the first thing I need to do is pull out my insulins, get my syringes, and get ready to be prepared to give these medications. So you'll look in your drawer. Sorry, I have that drawer in backwards. And you'll find then an NPH and a regular. They have to be the same brand. So if I'm going to give NPH and regular, then I'm going to pull up the same brand, NPH and regular, okay? I'm going to need alcohol swabs. I'm going to need insulin syringe. I need to figure out how many units. So this tells me that I'm going to give 38 units of NPH and 14 units of regular. So added together, that's 52 units. That means then that I need to use a 100 unit syringe because I can't give 52 units in anything else. So if you're following along on your sheet, it says number 1, review comp card for patient information in order. You have to kind of make up when you're practicing what their blood glucose might be. Let's just say that Charles Edwards' blood glucose is 250. We're going to log into the computer. Here, it says outside the patient's room, but remember, this will be outside the patient's room. I don't mean at the MDU cart, I mean here. Perform hand hygiene, check the BG. So this is where you would, either it's going to say on your card, or if you're practicing, you're going to make one up. Know the actions, special nursing considerations, safe dose ranges, blah, 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 of your insulins. Get the medication and insulin needed for the patient from the drawer. So we already did that. Gather supplies needed. We got alcohol swabs, and we're going to get a syringe. We just discerned that for this patient, then we need a 100-unit insulin syringe because we're going to give greater than 50 units. Do the first check and prepare the medication. So I don't need any gloves for this. I do need alcohol swabs, so I can clean both of these 15 seconds. Back my table up there so I'm not shaking my video there, making you guys sick. So we'll say that's 15 seconds. We'll say that's 15 seconds. If the medication is a suspension, which typically our NPH insulins are, they need to be mixed. We roll it gently in our hands to mix it then, like this. We don't vigorously shake it to mix it. You just make sure that it is. Now, on your sheet, it says, if giving a correctional dose based on sliding scale, read the order to determine the amount of insulin needed. That's not what we're doing for Charles Edwards. We're giving him a nutritional dose that's 14 units sub-Q QAM. That means we are giving that in anticipation of him eating breakfast. Along with that, we're giving him 38 units of NPH insulin, which is our intermediate acting insulin, to kind of last him and provide some coverage throughout the day to best mimic what the pancreas should be doing. So if mixing insulins, move to the next part of the skills demo steps below. So your paper is walking you through that. You're going to go then to step 33, where it says cleanse the rubber tops. I already did that. Take time to decide how much of each insulin to give. I know that, 38 units and 14 units. Remove the cap from the needle by pulling it straight up. So now I'm going to start with my syringe. Touch the plunger only at the knob because this is going to go up in, okay? So in total, I need 52 units of air. So you can either do two things. You can pull up just the air needed for your cloudy insulin first, and then the air needed for the clear, or you can do them all together. I think it's best to do it separate so you don't have to worry as you're pushing air into one that you're going too far. So we are going to ultimately draw up clear before cloudy, meaning fast acting before intermediate acting, but I have to put air into that intermediate acting vial first, okay? So I'm going to pull up then. You can move this safety on this syringe too to get it out of your way if you can't read the little lines. So I need 38 units of NPH. So I'm going to pull this little insulin syringe up to 38 units. I've cleaned this. I'm going to go in at a 45-degree angle and then straight down in. So just a little bit at 45 when you're going in, okay? We're going to inject the air into the air. So we're not going to let this touch any of the insulin that's in this vial. I'm going to pull it straight back up, and now I'm going to draw up the insulin that's equal to my regular air that's equal to the amount of regular insulin I would like to give. That's 14 units. Okay? I'm just going to pull this back so I don't contaminate that. I'm going to go, again, 45, and then I'm going to go straight up and go in. Now I'm going to inject my air, okay? And now I can invert the vial of the rapid acting and go ahead and draw up. I need 14 units. So for this vial, I can pull up a little bit more if I need to, but I really shouldn't. Typically, these work pretty good, or I drop a little bit more and then I push back. Okay, you're looking for any air bubbles. If you have any air bubbles, you know, you're going to flick those out of there. You could take this out, flick them out, put it back in. It's most ideal just to keep it in for, microorganisms and asepsis and things like that. Okay, so I have 14 units of regular insulin. I need to then really check this 3 times. So I have regular insulin, 14 units. It's not expired. This vial lasts for 28 days after being opened, so I know it should have a date that it was open and a date that it expires. I can do 14 units. Why am I checking this 3 times? Because once I mix in that intermediate acting, I can no longer do 3 checks of this first one that's in the syringe. So that's a little bit different. So 14 units, okay, regular insulin, not expired. 14 units, regular insulin, not expired. I've checked that now 3 times, okay? Now I'm going to go into my, so if we're following along in steps here, we just did 38, hold the, we injected the air, we inverted it, we hold the vial in one hand, use the other hand to draw the medication. Check number 40, we checked there was no air bubbles in the syringe. 41, check the amount of medication in the syringe with the medication dose and discard any surplus. So we just did that. Recheck the vial label with the MAR, must check this dose 3 times before adding in the next insulin. So we just did that. Calculate the endpoint on the syringe for the combined insulin amount by adding the units together. What that means is I have 14 units in here right now, but I know I need to ultimately have 52 units. So when I go now into my intermediate acting, which may need to be reconstituted again if it was sitting for a while, I'm going to draw up all the way to 52 units, okay? So now I'm going to insert the needle into my NPH. Again, we're always going in at starting at 45 and then going right up to 90, okay? I'm going right here now, and I'm going to draw very carefully to 52. I can't go beyond 52 because I can't push anything back into this vial or I won't know the concentration that I have in this. I need it to be very precise. So this is very easy for us to make a mistake, but we have to go very slowly. And as long as we had no bubbles before, we shouldn't get any more bubbles now. Okay, so I'm going to go slowly to 52. If I go beyond that, I got to start over. Okay, so go nice and slowly till you get there. There's no going up and down with this. I have to have precisely the amount of insulin that I needed to have. Okay, recap the needle. We want to do that with 2 hands, or you see how this sits like that on the table? I can actually go one-handed and go like that into it. If you're going to do scoop, use 2 hands because this needle will bend very carefully or very easily. If it bends, you got to start over because you can't take this needle off and just get a new needle. It's one whole syringe together, okay? So now we want to make sure I have both my insulins, and really now I'm checking, I have NPH insulin, right? I just drew that up. I already looked at this against the MAR before I drew it up, obviously, but even if I didn't, I still need to check it again because, well, I now need to know what's in there, but we checked it beforehand. NPH, now I know I had 14 units, so I know in my head I've calculated I need to have 52 units. So I have 52 units. NPH, I've checked that, okay? What we need to do now is label this syringe. So I'm going to get a syringe label here, and I'm going to fill that out. Patient, drug, insulin, amount, I can say 14 units regular, 38 units NPH, date, time, all of that same stuff. Then I'm going to put this on my syringe, not covering up where my dosage is. I'm going to take my vials and all of that. I'm ready to now do my second check. So on your paper, okay, we are at step number 48. Now we can, after we perform our second check, so we say we've got our 2 vials. I already know I have 14 units of regular in there because I checked that 3 times. I now am saying, okay, I need 38 units of NPH, so total that's 52. That makes sense. I've done my second check. Of course, then I'm going to move into the patient's room. I'm going to perform hand hygiene. I'm going to ask my patient their name and date of birth. Hi, Charles. How are you today? I'm Shayna. I'm going to be your nurse. I have your insulin for you today. I already know your blood sugar is 200. Okay. I see that lunch is scheduled to come in a half an hour because I'm giving you regular insulin that will have an impact in 30 minutes. So I need to make sure they're going to eat within that 30-minute time frame. I need to check your name and date of birth. Charles, can you tell me your name and date of birth? I look at his band as he's telling me, and I also look at the MAR because that's really checking against the MAR. I need to make sure I have the correct MAR. I then am ready to really go ahead and give it, just like with any other med comps that you're going to do. You're going to give these injections into these little pads. You're not going to put any liquid into these. You're only going to inject air. So when you're ready to do that, your instructor should give you a syringe that has the appropriate amount of air into it. As you're practicing, just remember, don't put anything in that. So you want to make sure that you know that you verbalize to your instructor the onset, the peak and duration of the medications that you're giving. And once you've done that, you have your BG, you've considered food, you're ready to actually administer your medication. We scanned, of course, which I can't remember if we did, but when we check his band, if we haven't, we're going to scan his band. We're going to then scan our medications, clicking in the correct box. So there's our NPH. And remember, get in the right column for the time. So here's our NPH. Here's our regular. Okay. And I'm looking on here then to make sure, okay, I should have 52 units. That makes sense. That's what I have. Now that I've really done my third check, I'm really ready to actually administer this. I need another alcohol prep. Patients that are in the hospital, if they give their own insulin at home, go to the back of the arm because it's a really good site that they haven't used before. So 15 seconds on the skin. I like to set my alcohol to the side so I know where I've cleansed. Let that dry. We're going to go ahead, pull the cap off, hold it so that your finger can come back and inject. We're going to hold this up. We are going to go in at a 45 or 90 degree angle like this, and then we're going to inject. I have liquid in this, so I'm not going to put it into this pad. I'm going to go nice and slowly the whole time I have that pinch. I'm going to pull out. I'm going to let go. I'm going to put the safety up on that. Okay? All of those steps are there. Of course, we need to then take our gloves off and perform hand hygiene.